Mueller, and I'm coming to you today from the Sports Medicine Rehabilitation Clinic at Bloor and Dundas in Toronto. I would like to talk about a very common situation for many of my new and long-term patients who are presenting with upper back and neck pain. They will come in with tension in their upper traps, sometimes the base of the skull, maybe TMJ issues, oftentimes upper back and in between the scapula they'll have pain and stiffness, and it's really resistant to self-care. They can't figure out what to do about it. Many of these people also sit for many hours of the day. They may sit in front of a computer, they may be a hairstylist or a tattoo artist or a dental hygienist. Many of these occupations and professions require people to sit, sometimes with the hands in front and or slumped slightly forwards. At the beginning of the day when you're working at a computer, yeah, it's possible to sit really upright, but the longer you sit there, gravity starts to win that argument, your head will start to shift slightly forwards, and you will start to slump a little bit. After a long period of time, the ligaments in your upper back and neck will be sitting on stretch, and your back will become more and more irritated over time. So when these ligaments are sitting on stretch, they become elongated and more pain sensitive. Plus the muscles that are superficial to those will then have to tense up a little bit to compensate for these tired and irritated ligaments. You're not designed to hang on your ligaments. In fact, you're not designed to be still that way at all. So the first recommendation I will give to patients is every 20 minutes you want to stir the pot. That means get up and move around and interrupt that prolonged posture. But what do you do when you get up and move around? It doesn't have to be fancy, but there are a group of exercises that I have found to be particularly helpful for many of my patients over the years, and I'd like to go through some of those with you now. The first exercise I'd like to discuss is called jaw jut chin tuck. In side posture, I imagine it looks a bit like a slow motion woodpecker doing its thing. So if you're sitting nice and upright in a chair, you move your chin forwards and tuck it back, and forwards and tuck. Repeating this somewhere between 5 and 10 times, taking approximately 3 seconds per cycle, up to 5 seconds. 1, 2, 3, 4, somewhere in the 3 to 5 second range works really nicely, so you're not rushing. You will feel a bit of a stretch at the end range in each extreme, and after you've done this, you should feel a little more warmth and mobility in the joints at the top and bottom of your neck. The next exercise I'd like to talk about is the shrug. Moving your shoulder blades up and down. I love the feeling of relief after I cycle through this one. Once again, 5 to 10 times, 3 to 5 seconds per cycle. I want you to imagine that your shoulder blades are on a clock. They're moving up 12 o'clock and down 6 o'clock. Up to 12 and down to 6. The next exercise would be the scapular pinch. So now I'm moving 3 o'clock, 9 o'clock. Now the rib cage has a little bit of a curve to it, so it's not a complete flat plane of motion, but you're going to open and then squeeze to pinch, and open and squeeze to pinch. Between shrugs and pinches, you get a lot of warmth through your chest and your upper back. We're trying to increase the blood flow and decrease that sensation of being stuck and still. The next exercise I'd like to show you is called Brugger. I like to do this standing. It can be done sitting, but I prefer it standing because at very least that gets you out of your chair on a more regular basis, and we do need to do that. So I'd like you to stand up, and I'd like you to slump forwards just a bit, let your head fall forwards, let your shoulders roll, and then start with the hands. Open the palms to face out, Extend your arms behind you just a little bit. Look up to the ceiling. Hold and relax. Repeat by slumping forwards once again, letting your head fall forwards. Open those hands. Open the shoulders. Look up to the ceiling. And rest. You'll feel that this incorporates a few motions. It will incorporate the scapular pinch, and it will also force you to move your neck into extension, which is the opposite of what you've been doing a lot when you're sitting still in your chair. One final exercise that I'd like to go over today is called the W exercise. This will help set your scapula in a more retracted position, and it will engage the inferior trapezius to help keep the shoulder blade back and open your chest for easier breathing and more comfortable sitting. I wish we didn't have to sit, but if we do, we might as well mix it up a little bit. So with the W exercise, I like to employ a TheraBand. I touch my elbows, tuck them in tightly to my side, hold my hands just about chest height, and externally rotate. At the very beginning, when I'm setting, the first thing to happen is the shoulder blade will sit flat to my rib cage. Before I even move my hands, I will sit. When I push the elbows tight to my body, I will also pre-contract a little bit to get that shoulder blade to sit flat. Then externally rotate so that my body now looks like a nice little W. One of my favorite simple exercises. It's a nice simple rotation, external rotation of the shoulder. But first setting the scapula. Both arms together makes the W. I hope you found some of these exercises helpful and that you can start mixing them into your normal daily activities. Try not to sit too long. Your body wasn't designed to be still. And if you need additional help, we love to help you at the clinic with some of the manual therapeutic interventions we can offer as well, and further specific education to your needs. Hope you have a great day. Take care.